Today we begin a new segment on Daytime TriCities called Get Medicare Educated with the Mackie Group. And here to talk about Medicare enrollment periods is Andrew Price from the Mackie Group. Andrew, appreciate you being here this morning.
Thank you.
Let's talk about this. A lot of people get confused about enrollment periods, but let's say someone's wanting to enroll. What do they need to do?
Well, getting enrolled in Medicare is actually really easy. You either have to be turning 65 or be on Medicare disability. And to get actual Medicare, which is your red, white, and blue card, it's automatically sent to you because most people are already drawing their Social Security, so you actually don't have to do anything to get actual Medicare. Now, if you're not drawing your Social Security, you do have to contact the Social Security office and apply for Medicare Part B.
And let's say, you know, the enrollment period's already over with, but say let's find out that you find out about your plan and you're not really happy about it. What can you do about it?
So the annual enrollment period is over. That runs from October 15th through December 7th. Last year, Medicare actually started a new enrollment period called the open enrollment period. The open enrollment period actually runs from January the 1st through March the 31st. And this is for people that had a plan, maybe changed their plan, and then come to find out it wasn't the right plan for them. They actually have one opportunity to change that plan until March the 31st.
And you know, we hear a lot about penalties when it comes to Medicare. What can you do to avoid penalties in Medicare?
So that's actually really easy. There's only really two penalties with Medicare. One is not enrolling in Medicare Part B when you need to. So like I said before, when you're turning 65, enroll into Part B. That penalty doesn't happen if you're working and you have coverage through your employer. The other Medicare penalty is what's called the Part D penalty. That's the drug plan. So whether you need a drug plan or not, you should probably get one so you don't have that Part D penalty.
There's a lot of information out there about Medicare, and it can be confusing. Now, what do people need to, why is Medicare so confusing? I guess that's just the basic question.
So Medicare is confusing for a few reasons. One, because it's insurance. Insurance in general is Greek to a lot of people. The other thing is there's so many plans out there, and because there's so many choices, it confuses a lot of people. And to be honest, there's not a best plan. It depends on your doctors, your prescriptions, your health, your lifestyle, and all that kind of different factors come in to make one plan better than the other for your situation.
And you have some educational seminars coming up. Tell folks about those.
Yeah, so I do a Medicare 101. It's an educational seminar for people to come and talk to a live person, to ask questions and kind of figure out everything they need to know about Medicare. It's an educational seminar, so I'm not selling anything. It's just all about education. And with COVID and everything that's going on, we haven't been able to do those back in 2020. So we're doing our first seminar at Christ Community Church right down the road here in Johnson City on March the 18th. We're also going to have a Zoom meeting available that if you're not comfortable coming to a live in-person event, you can register for a Zoom meeting as well.
When it comes to Medicare, what is that one question? What is that one question that you get all the time when people are starting to consider Medicare?
Well, probably the number one question is, what's the best plan? And we actually represent all the plans that are available because there's not a best plan. Actually, with a husband and wife, a lot of times I'll have the husband on one plan and the wife on another plan because they're on different, you know, they take different medications and they have different doctors and different health needs.
And since we're starting this today as a brand new segment here, I want you to introduce the Mackie Group to our viewers. Kind of give us an overview of what the Mackie Group is.
Well, we've been in the Tri-Cities region for about 13 years now. And like I said, we represent all the different companies. And so what we normally do is just kind of sit down with folks, let you know a local, live agent that you can answer questions and help you figure out what you need to do if you need to do anything at all.
All right. Andrew, we appreciate you taking some time with us today. We'll give everybody some information right now about that Medicare Enrollment Seminar coming up March the 18th at 6:30 p.m. Christ Community Church here in Johnson City. You need to RSVP right there to that number or that email address right there for Andrew. And also, here's some info for Andrew right there at the bottom of the screen, Andrew Price. He is right there on the Bristol Highway, Suite B, 3121 there on the Bristol Highway. Give him a call. If you've got questions about Medicare, he is a great resource to get you started down the right path when it comes to Medicare coverage. And we'll be back with more Daytime in just a few moments.
The preceding portion of Daytime TriCities was sponsored by...
Are you looking for the